Let's say to a lady, her breast is bothering her. And usually they're very shy to come up and discuss that with anybody. They may be able to discuss with the spouse, partners, family. The solution can be provided by everybody and then they can approach the doctor and then it can be a good uniform decision. But many a times they are not able to share it with anybody. There is another group of patients who are perfectionists. They want everything perfect. I'm not God. I'm an artist. Yes, I can paint, but I'm not a perfectionist.
That is true.
Breast implant does not cause cancer at all.
I think, Dr. Sanjay, that another topic that actually we need to be able to address is the most people understand the concept boob job. For them, boob job means increasing cup size. And boob job is quite essentially breast augmentation. But there is a lot of confusion that people have in their minds about, is boob job only that? Or are there other facets involved to it? Is it something about correcting the shape as well? Is it about correcting the volume as well, apart from just increasing the size of the breast from, going from, let's say, one size down to looking something closer to a Pamela Anderson sort of a boob job situation?
So first of all, I hate the term boob job. Okay.
Yes.
Yeah, I know people understand that, but it's breast reshaping or breast enhancement. Okay, it's an artwork.
Right.
Breast enlargement is not just pumping volume and increasing the cup size. It's an artwork. It's the work to make the breast look pretty, beautiful, and ensure that it stays beautiful for a longer period of time.
Right.
That's actually the essence of breast augmentation.
So that would also include, let's say, someone who has a saggy breast and you're doing something for her. That would also come under the concept of breast reshaping then.
Absolutely.
Because you're correcting their breast size, shape, and volume at the same time to give them the kind of breast that they want in the end.
Yeah, that's correct. There are so many problems people suffer with. Okay, obviously it's such a sensitive subject that it's not the material is not enough out there for people to understand.
Very
So
true.
people may have problems of smaller breasts where they feel it's inadequate, not giving them the profile that they're looking for, or it may be too big a breast which is causing problems, shoulder problems, back problems, or it may be different size of breast. There are many people who are born with different size breasts, or they during the developmental phase one breast develops more than the other one.
Yes.
Or there are conditions where breast shape does not look normal or natural. It's abnormal. It's called as tuberous breast.
Right.
So breast enhancement or breast reshaping is for any of these breast problems. And breast augmentation is just one part of it where the breast shape is good. It's in a right position, but just enhancing the shape of and the size of the breast.
So one very, very common segment of the population who requires this kind of help or is looking for this kind of service are definitely people, women, who have had multiple episodes of weight gain, weight loss, weight gain, weight loss, or even mothers that post breastfeeding, post pregnancy, there is a lot of sagging in the breast. So do a lot of these patients overall then come to whom you're able to offer breast reshaping as a procedure and correct their major concerns? Because it can be, you're starting an entire journey of wanting to become fit, and although you get there, you end up losing volume from some part of your body that primarily makes you more feminine. So how do you sort of approach patients who have concerns like this?
So, Dr. Kriti, we know, as professional, both of us, we know the biggest problem for any part of the body is the weight fluctuation, be it face, be it breast, or be it any part of the body.
Yeah.
Weight gain, weight loss, weight gain, weight loss is going to negatively impact your body. And talking specifically about breast undergoes a lot of toll. All right?
Right.
The regular weight gain and weight loss, the pregnancies, the after effect of the breastfeeding, all of those things changes the breast. My advice would be for people, let's say, who are not yet married and they want to have a good, breast shape and size, is to maintain the weight. Live a healthy lifestyle And this should be right from the childhood. I mean, the concept that we have in India of overfeeding the child is criminal, is crime. We are overfeeding the kid. Just because the parents want to feel good, they have a chubby kid.
Yes.
That's, a torture to the kid. Then they produce a lot of fat cells, which remains like a bang for the rest of their life.
Yes, fat cells never forget.
And the second trauma happens when the hormone surge happens. That's the adolescence. That's when many times problem can be corrected. When there is sudden growth and metabolism changes and people lose all that baby fat and stuff. So that's good. Many people are lucky they do that. Many people are not so lucky. It continues. And because of the hormonal, the problems becomes more.
Very true.
So I think all the problem is weight, basically.
Yes. I think in our practice in general, we've seen how much weight negatively impacts not only their skin, the rest of their body, their mental health, and then you can add spiritual health, all of that to it. And overall, one of the biggest challenges that we face is getting people to be adequately motivated to take care of themselves, which should ideally be their first priority in life, their primary goal, their primary motivator. But it becomes more challenging to get people to focus more on themselves truly, rather than let's just look for a quick fix.
This is also a little bit like, it's called, people understand it as plastic surgery addiction.
Right.
Okay, that's actually a fact. One is in a positive way, it is good, where people see a positive benefit of that. Let's say they have done breast augmentation, it turned out beautifully. It has changed all their confidence and they are very happy about it. And then eventually in the life, when they become bear child, they become pregnant, they lose, they want to have a tummy tuck, they'll be very happy to come back, and they are happy to come back to us and get the surgery done. So that's a good thing.
Right, definitely.
And then as they grow older, they feel, this has done very well. It really changed my confidence. Now I have this issue of sagging because of age. Let me address that. So that's fine.
Right.
But there's also plastic surgery addiction, which is negative.
Right.
Which is people just want to do something. The many times they come to me and said, I haven't done anything since 1 year. What do you think, doctor, I can do, this time? So you do have patients like these as well who want to just keep coming back. And yet there is another group of patients who are perfectionists, and they are the biggest headache for me, honestly speaking. The big headache. Because they want everything perfect. I'm not God. I'm an artist. Yes, I can paint, but I'm not a perfectionist. I'm not God.
That is
so they are unhappy about a little thing here, a little thing there, and they keep want to coming back and doing it. For me, I like to push them away.
I think overall, our general philosophy, as long as it stays towards learning to love yourself and us helping them along the way, it's great. But the minute somebody expects from us to suddenly be gods, who are completely reshaping, restructuring everything from ground zero to 100, that's when challenges start to happen, because there is an expectation mismatch between the doctor, between the science, and between the patient. Has there ever been a patient for whom you've rejected, or for whom they've not gone ahead and done breast reshaping or a procedure like that?
So there are situations, there are times when you have to not choose that option. And one of the reasons is medical reasons, obviously. If people are suffering from medical problems, then it's not always safe to go ahead and do the elective surgery. So people have diabetes, have hypertension, which is not controlled. They are on a lot of medication. They have other more serious issues which needs more importance than aesthetic surgery.
But is that related to age?
So that's not related to age. Now, as far as age is concerned, when a person is fit and grown up enough physically and psychologically, that's the time to start any procedure. Let's say breast augmentation, I would probably do in a person who is fully developed, at the age of about 18 to 20, where she's mature, understand to take a decision on herself, by herself, that she wishes to do it and she wants to do it. That's the right age to do the surgery. As far as old age is concerned, then it depends on what is the problem they're facing and whether they are fit to undergo that procedure. So I have done breast surgeries in a lady of 75 78-year-old, where she was physically fit, looking good, and had a positive desire to change the shape of the breast.
Yeah, because we routinely get patients who are 70 plus,
Yeah.
who they have diabetes, they have thyroid, they have, you know, the general pills that everybody's on by that age, most of the population, and they are still undergoing procedures like this. So it's not the comorbidities that sort of make it impossible for anybody to undergo the procedures. There are certain subsect of, I would say, medical conditions that would make us hesitant as doctors to consider them as, you know, कि हाँ,
So
इनके लिए हम कर सकते
so you have to
हैं.
evaluate the health.
Right.
You know, if any of these conditions is controlled by their medications, you know, then it's okay, safe to go ahead and do this procedure.
Anything that you think is an absolute no-no, like, you know, this patient is uncontrolled diabetes, I would not do it. A patient who, मतलब हर 2 साल के अंदर weight fluctuation तो ऐसे हवा के माफिक होता
Well,
है.
no, so those are relative contraindications या relative reasons होते हैं. जो absolute reason है वो ऐसा medical problem, जैसे किसी को हार्ट अटैक हुआ है, उसको स्टेंट लगे हुए हैं, बाईपास हुआ है, तो उसमें मैं कॉस्मेटिक सर्जरी यूजुअली नहीं करूंगा, क्योंकि वो बहुत सारे मेडिकेशन लेते हैं जिनसे ब्लड थिनिंग होता है, जिससे कॉम्प्लिकेशन, ब्लीडिंग कॉम्प्लिकेशन हो सकते हैं. दीज आर एब्सोल्यूट कॉन्ट्राइंडिकेशन. या किसी को क्लॉट का प्रॉब्लम है, जो जो बैठे बिठाए क्लॉट्स बन रहे हैं, यहाँ क्लॉट्स बन रहे हैं, वहाँ उन पेशेंट्स को मैं हाथ नहीं लगाऊंगा, उन पेशेंट को सर्जरी नहीं करूंगा मैं. सो दे आर एब्सोल्यूट कॉन्ट्राइंडिकेशन, उनमें नहीं. पर बाकी इवैल्यूएट करना बहुत जरूरी है.
या स्पेशली अब what you were talking about, it's a rampant problem जो इंडिया में होने लग गई है, which is what childhood obesity, especially for women in this case, क्योंकि उनका जैसे weight fluctuate होगा, ऊपर नीचे होगा, by the time they reach their mid-25s, we've had patients who've come to us who are already suffering from sagging breasts, and it makes such a huge impact to how they view themselves, how they feel about themselves, what kind of clothes they can wear or not, because everybody wants to be able to wear dresses, right? And they're not able to. So how do we then approach these patients? Do we say yes to them? Do we wait till we feel that they're a little bit more mentally ready? Or do we feel overall, you know, this is the time to intervene? We should do it. What do you say to that, Dr. Sanjay?
See, when I think is, if something is bothering to the person, let's say to a lady, her breast is bothering her, and usually they're very shy to come up and discuss that with anybody. They may be able to discuss with the spouse, partners, family, you know, mother, sisters. If they're able to discuss, it's always easier, because then the solution can be provided by everybody, and then they can approach the doctor, and then it can be a good uniform decision. But many times they are not able to share it with anybody.
Right.
So in these situations, if they have that, they can access a doctor or a psychologist who they can sit down and tell them their inhibitions, or tell them their lack of confidence, the reasons for it, you know, then it can open up the subject, right? And at this point, what our duty is to educate them, because they are not mentally prepared. They have just come out and they have started discussing. So in that situation, we'll become a psychologist to them.
Right.
First, try to understand what is the problem, how much of that problem is affecting the day-to-day life, you know, or their personal life, or their marriage life, or any of those things.
And if you feel that it is affecting,
then
we go ahead.
You go and help them.
Right.
Yeah.
I've heard so many of our patients constantly wondering, does a breast reshaping procedure mean that there will always be an implant that is put in? If an implant has been put in, is it cancerous? Does it lead to any kind of problem? Do I have to replace my implant 10 or 12 years later? So when these kind of questions keep coming up again and again, I do wonder what kind of information there is out there in the world for people to constantly keep having these confusions. So Dr. Sanjay, what would you like to say to our patients where this confusion doesn't really seem to die down at all?
Breast implant definitely has a lifetime. Okay, scientifically now it is a known fact that any permanent device which is placed in the breast is only for 15 years. Okay, which means that after 15 years they need to get the breast checked by doing an MRI or a scan or whatever type of test it is, and best is always MRI,
right,
and to see if there is a problem with the implant. Okay, now many times if there is no problem with the implant is intact, there's not much changes in the breast that has happened over a period of 15 years, then it need not be changed at that time.
Right.
Right? But if there are any signs like hardening of the breast, pain, discomfort, or because of body changes, the breast has changed and they may want to improve the breast further, that is the time that you change the implant as well. So yes, it's not a permanent device. It needs to be changed at some point of time. But having said that, many people have it for many, many years, even 25, 30 years without any problem.
Right.
But once you have breast augmentation, it's good to be in touch with your doctor to get it examined.
But the breast implant itself doesn't cause cancer.
So as far as cancer is concerned, no. Breast
Yeah.
implant does not cause cancer at all. Now what happens is when you put breast implant, body forms a defensive layer around it.
Yes, true.
Okay,
To
body is
any-
very
and
smart.
Yes, yeah.
And the purpose of that is to retain that implant in that position. Now, what can though happen? So, it's not going to cause any impact on the breast tissue at all. No cancer, absolutely not. But there was a certain kind of implant actually that was popularized in the US, where that implant was not of the best quality, and that implant started irritating the capsule which the body had formed around, and that became a problem.
Right.
Okay, and that was called as ALCL, which is basically a reactive immunological reaction of the body against that material. But when that happens, it will tell, there will be signs that will be produced. And then at that time, the patient needs to go to the doctor to get the scan done and eventually get that implant and the capsule removed.
That inflammatory response is pretty much too, like, you know how you would respond to an annoying house guest.
Yeah, absolutely.
You're
It
not
is
a
almost-
person who gets
Yeah,
angry or
yeah,
annoyed, but because
yeah.
that person is constantly annoying you,
Yeah,
you get annoyed all
annoyed
the time.
all the time. Correct.
The minute you take that person out,
Yeah.
you're no longer annoyed
Yeah.
anymore.
So now the modern guests have become better, which means the modern implants are much better. They don't annoy the body as much, so you don't need to remove them.
Right. No, that definitely makes a lot of sense. I feel like a lot of people, the reason why our patients sometimes get hesitant, especially women who really love being in fitness. They love doing their exercises, they like doing their upper body, especially strengthening, to be able to pull themselves up. So there is a lot of confusion in their mind कि अगर मैंने जो है breast implant कराया तो मैं फिर upper body exercises नहीं कर सकती. And to a large cases, it depends on किस तरीके का आप procedure कर रहे हो. So Dr. Sanjay, what would you want to say to that?
None of this procedure of the breast, whether it's implant or lift or reduction, will stop anybody from doing exercise lifelong. So there is a healing period which you have to avoid exercising, let's say a month, month and a half, 2 months. But after that, they are able to do anything and everything. Okay? There is no problem. There's no contraindication to that at all. Let's say, when we do breast implant, there are two positions we put the implant. One is behind the muscle and the other one is in front of the muscle. Okay?
Right.
When you put behind the muscle, often what happens is when people exercise, it does not look good because the muscle squeezes the implant and it looks like the breast is talking to somebody. So that is not an acceptable problem to the women. So that's the reason more and more now internationally people have started using the implant in front of the muscle. So that problem doesn't happen. But yet in certain situations you still have to do that. Like people who do not have enough breast tissue and they're very thin, very skinny, in them there's nothing in front of the muscle to cover the implant. So in such situation you have to put behind the muscle.
But even if it's behind the muscle, post that healing period, post those 2-3 months of healing period, post that, can they do lifts? Can
They can do everything. They can
even
do
if they're okay with
weightlifting,
their
they
own
can
breast talking to each other,
absolutely,
let's say.
they can do everything.
They can do everything.
There's
They-
absolutely no restriction in that.
Yeah, right. So at the end of the day, it's very, very important to understand that we need to not only love our bodies, we also need to take care of our bodies. Aesthetics and wellness goes hand in hand. If you've loved this discussion between me and Dr. Sanjay Parashar, make sure to leave your likes below, and any other topics that you have in your mind that you would want us to discuss, make sure to drop that in the comment section.